everybody. Welcome back to the podcast. Again, my name is Dr. Ariel, and I am a mobile physical therapist as well as a yoga teacher. And I specialize in performance therapy for active women, active men, and also pelvic health rehabilitation. So I want to talk to you all today about the transformational process of physical therapy and how it occurs off the table. So if you've ever had physical therapy before, especially in the traditional sense, you probably have noticed that PTs use plinths or tables. You might even see in the back here, I'm a mobile therapist, so I have a massage table that I carry around with me to clients' houses. And really, a lot of people think about traditional physical therapy as, okay, I'm going to lay on my back, I'm going to do a couple exercises, we're going to target some specific muscles. The PT is going to give me a massage, and then I'm going to lay on some heat or some ice. Well, in my opinion, that's a bunch of bullshit, and it's not really going to help you get any better. There's definitely a time and a place where just being on the PT table can be really helpful. So, for example, if we have an individual that's really deconditioned, like if they're right after giving birth in the early postpartum phase, also if you're right after surgery, you're in a lot of pain, it's hard to bear weight onto your leg or your arm, depending on where the surgery is, then it's 100% appropriate to do all your exercises on the table. Also, when we're working with folks who might have issues with blood pressure, I specifically also work with a lot of hypermobile folks who have Ehlers-Danlos syndrome. And a comorbidity associated with that is called POTS, or postural orthostatic tachycardia syndrome, in which these folks stand up, and the longer that they're standing, their blood pressure cannot kind of help pull blood back up to the heart. So they get really dizzy after they're standing for a while. So there are definitely reasons why you would stay on a PT table for your entire session, 45 minutes, maybe an hour. There's definitely times where that's appropriate. But if you've been going to PT for months and months and months and you're still on the table, your body is healing and you're kind of at this plateau where you haven't actually done any exercises against gravity where we exist and live, then you're really at a disadvantage, and that is not the physical therapy that's going to allow you to get back to your life into active tasks. When we think about physical therapy and really what the purpose is to do, there's kind of a couple different purposes that I like to think about with the transformational process. One is that not only am I as a physical therapist here to help you, but you're also in charge of your health as the active client. So that means you're not just laying there. I'm not just telling you things to do. I want to have a conversation with you. I want to understand what things matter to you. What are your goals? And tie our exercises directly to those goals. For example, if your goal is to be able to carry your child up and down stairs, well, laying on your back and doing exercises is not going to get you the capacity in your muscles to be able to carry a 30-pound child up and down the stairs. We have this gap right now between traditional physical therapy and getting back into life or getting back into higher level activities like recreational sport or weightlifting or power yoga. And basically, because insurance companies dictate what physical therapists do, there's this idea of, if you work in an insurance-based model, you're teaching people tools in order to get them back to 80% of their prior level of function before this injury or surgery. Well, what about the other 20%? The other 20%, in my opinion, can be even more difficult to get back to on your own. We're talking about things like how to go up and down the stairs safely and with less pain. We're talking about, now going up and down the stairs. And again, how do you carry a bag of groceries up and down the stairs after a knee surgery? How do you, after an ACL repair, get back to playing soccer recreationally or coaching soccer for your kids? And that gap is exactly where performance physical therapy comes in. So if we think again about why the transformational process of physical therapy exists as this active process where the physical therapist is not just sitting there telling you things, but it's really this interactive collaboration between the client and the PT, well, then how can you optimize your physical therapy experience as a client and also find a physical therapist that's going to help you get back to these active goals? Number one would be just making sure when you're finding a physical therapist that you're finding somebody who does the same activities as you. So does your PT lift? Does your PT teach group exercise classes if that's something you want to get back to? Does your PT carry maybe an extra certification in strength and conditioning coaching and is familiar with barbells and lifting weights and not just 5-pound dumbbells that we see in a lot of PT clinics? Number two would also be just speaking up about your needs as a client. So you have a right as a client to go to whoever you want to. Oftentimes, because there's a lot of politics involved in the medical system, if you didn't know, if you go and ask for a referral from your primary care doctor or even from your surgeon, they might send you to a clinic where they own the clinic and they own the therapist. So that obviously creates a little bit of discrepancy between, are you going to get really an individual perspective from your physical therapist? Or are you just going to get a protocol that's created by a surgeon that's carried out by a PT? So making sure you're having conversations around your right to choose whatever physical therapy office you want and not just the one that's on your referral. So that'd be number two. Number three is making sure that in that first day on PT, even if, you're post-op or if you're early postpartum, mentioning some of the goals you want to get back to. I think people just don't even realize that physical therapists can help you get back to these really high-level tasks. It doesn't have to be professional athletics, but if you want to get back to pickleball, you should mention that. That is something 100% that you can work on really early on, even if you're post-op. You're not necessarily going to be doing agility work, but maybe we're thinking about how to optimize ranges of motion that apply towards that activity, or how can we keep you at least involved in that activity for your mental health, if that's something you're doing, not just for the physical, but for the emotional sake of community. Another aspect of this is also just making sure that your physical therapist understands exercise in general. This is a huge gap in the physical therapy education curriculum for most schools, where PTs are very scared to exercise people to intensity levels that cause them to sweat, that cause them a little bit of discomfort. But really what the science shows us is that manual therapy or hands-on massage, joint mobilizations work the best when we pair them with exercise, and not just exercise on the table, but really functionally based exercise that's going to drive changes between the brain and the muscle. So again, this is a quick, rant car conversation, because as a physical therapist who helps people get back to activity, we call this performance physical therapy. It is super frustrating when I hear clients come to me and they've been to several therapists and they've said, nothing's worked for my back pain. And I asked them what they've done, and all they did was lay on the table. That's all they did. They laid on the table for 12 weeks. They did easy exercises, and they want to get back to deadlifting. It's no wonder why they can't achieve that goal, because no one's really showed them a step-by-step process in order to get there. So thank you all so much for listening. If you have any comments, you can leave them below. And peace until we see you again.